So let's talk for a minute then about, here we have this stuff we have to figure out. We have this burden on us to kind of figure out what we want to do. But how do we work with our doctor? How do we decide when to do this? What's the best way to work with our home hospital and figure out how to do it and get it done and still keep those relationships intact? Because sometimes that's not easy.
Sometimes I think back to 2004 when she was diagnosed. We did not do second opinions. I didn't know there was such a thing as an actual neuroblastoma program. I thought all cancer hospitals did, all pediatric cancers. We're very comfortable in our home hospital, so we didn't even think about it. But looking back, I kind of wish that I would have said, they told me what was going on, and I said, okay, who's doing the specialty stuff? I want to go talk to them all first, even though frontline is all the same, which I didn't know at the time. But I wished I would have gone and got informed, first, and then made our decision and started, so that I knew if something did go wrong that there were other places. I didn't for the first 2 years. I didn't know there were other places to go to. And once Melina had relapsed for the second time, and we were sitting down discussing stem cell transplant at our home hospital, and they were quoting all these different things going on at different hospitals by different doctors, and we thought, well, where are these doctors? Who are you talking to these doctors? Where are you talking to them? And how many, we're like, well, maybe we should go talk to them ourselves face to face and see what they have to say. And we asked how many stem cell transplants they had done for neuroblastoma patients, and they said 1. And that kind of was our decision right there. We just said, we need to leave. Not leave the hospital, we need to go for second opinions. We just wanted to go get more information. And immediately they were like, okay, that's fine. I said, can you help us? Can you get us there? And basically they connected us to who we wanted to go and see. And then we connected with each one of the hospitals, got our list of what kind of information that they wanted. Our home hospital tried to help provide all of that, the samples, the tissues, the scans and stuff. A little work on our part as far as making sure it was all done, making sure that they sent what they said they were going to send, and they received what they said that they wanted, so that when we got there, everything was in place and we can get answers on our specific child. So there was a little advocacy, a little bit of work on our part that we had to do, which was all a learning curve. We didn't, we're not scientists by any means in any way. So for us, our beginning experience of traveling was very good because they immediately helped us. They immediately got us to where we needed to be, and we picked up the ball and just started, following on both ends. We didn't just leave it between the secretaries or, the social workers, who are also a great resource when you do have to start traveling, because they will help you in a way they can, connecting you, helping you with the traveling part of it. If there's any programs that can help you pay for any of your gas or your flights or any of that kind of stuff, it's all available. If people know to just ask. There are people, you have an oncologist, but you actually have a whole team, which all of you know. And if you just know enough to ask for that help and that information, it is there. It's not always smooth in every hospital because we treat it in 5 hospitals, so we move several times. It doesn't always go so smooth because of just their personalities a lot of times. But then again, that's where at that point, most parents have learned to not be very quiet and to speak up and say, okay, this is what I need, this is where I need to be, and this is when I need to be there. And it's a lot of phone calling, a lot of staying on top of them, which I think is a little nuts that a parent has to do that when they're in the situation that they are. But that was our experience. We just learned to do that, and we just got very loud when we needed to and made sure we were where we needed to be.
How does it work for you guys in the States financially? All I know about it is that you have private medical insurance, and if you don't, you're stuck. Is that
Well, it depends
unfair
on
to
where.
say that? With the UK's, the NHS,
It's expensive.
It's expensive, yeah.
So if you don't have a good medical insurance and you end up in this world,
It could be difficult. It can be difficult. We had good insurance, and when we treated at our home hospital, we were covered, no issues. We paid $1,600 a month for that insurance. When we traveled in the same state to another hospital, we were considered out of network, and we owed, $340,000 in the first couple months.
so how do you do that?
Well, they didn't knock on the door, and we didn't open the door. So
As it comes, we pay.
Right, as they knock on the door, we'd say, okay, let's see if we can work this out. We also have Medicaid, in every
We got
state.
other insurances that helped us along the way and stuff
Right.
like that.
Which was, it took us a few years to get, get for Melina because of cancer, which gave her limitations, and we found programs that would try to help us get that. And so that's what we did. Once we got Medicaid, we were pretty well comfortable going anywhere that we went that accepted New York State Medicaid. It was at first, $400,000 that.
It took 2 years. We live in the U.S. and it took us 2 years to get that.
Yeah.
Because I'm self-employed, they wouldn't give it to us.
No.
But we had to hire somebody to finally get it.
And so for you guys that are already on DFMO, whatever the costs are, which I think we're gonna
Yeah,
get
so
involved
once
in,
again,
have you
insurance
had
is
to do
an ongoing-
fundraising or you private medical
No,
insurance?
We do like a website, and people ask what can we do. Like, oh, have you been to his Fund Me page? Or I send people to his website, and people are always asking what we can do, and so I tell them about that. Or we have events, and sometimes people put on events for you. Like we've got a race where somebody's like, I heard about your story, want to include you in the event. That's how we're getting by, because even the co-pays. You have a hospital stay and you got to come with $1,500, or they'll come up to you and say, "Oh, I know you're supposed to start taking this medicine today, but we don't have the pre-approval for the insurance. Before we give it, you got to give $800. Do you still want the medicine?"
The DFMO, on the DFMO trial, the DFMO is provided in the trial for free, as part of the trial. So you're not going to the pharmacy and paying for the DFMO.
Or the scans.
Yeah, you're basically just paying for your normal travel to and from, but the actual drug is provided in the trial.
But the scans you pay for.
This is
Yeah,
you pay for
right.
the scan.
Scan.
No, scans are not included in that because that's more standard care.
Oh, that's
follow-up,
standard
yeah.
care. Okay.
So Craig can probably address all that.
Yeah. So
Plus, it's not affecting the blood count, so they're not in the hospital for neutropenia or anything. So
But that DFMO and that trial is being paid for by funds that the parent groups have raised.
right.
I mean, on this trial, that's really thanks to you all, P&D.
So do you want to talk a little bit about that, about what it's like to enroll and how you do
yes,
that?
so insurance-wise, I'll just quickly address that. As that is a huge variable in everything that goes on with our families, because you go from private insurance, which has co-pays, or out of network, in network, and with our ongoing change in our United States of laws and bylaws of insurance, that's going to be it's going to be a moving target. So that's always a bit of a challenge. And limits some of our families of being able to come. Also secondarily, then there's Medicaids, which are state-funded insurances, which if you are in your state, so if you're a Michigander and you're in here, that's awesome and no problem. But if you are a California resident, California Medicaid wants to only fund California, hospitals. So they want to keep their money in state. So that's been some of our ongoing challenges. And some states are willing to work with us, some states are not willing to work with us. And that's just going to be an ongoing battle, and that will continue to change once again as state government officials change rules and laws. So that's where that is. As far as different programs for fundraising, there's some great different fundraising groups out there. There's some different electronic resources for being able to put stuff on. There's through Facebook that you can do some fundraising to help offset some of the co-pays for medications, offset some of the co-pays of your out-of-network benefits, different things like that that are online. National Children's Cancer Society, Alex's Lemonade Stand, Be Positive. There's depending on where your location in the country, there's different areas that are specific to that area, and there's also nationwide ones. So, and we try to work with our families in regards to all those to help them out as much as possible. Exhaust their local ones and then start using, more national ones. So that's always something that we pursue for our families too. And we've been fortunate in our hospital that we've had some private donors that have just specifically donated money for our families that come here to be able to say, hey, for me, that if I run into issues with our families, that I can pull some funds for specific helping cover costs of, different avenues, and we can be able to utilize those how we want to. So we've been very fortunate with different fundraising, different groups helping us out. And also, families being persistent with insurances. you know, I'm bugging them on one end and families bugging them on the other, calling their, you know, whoever their employer is to try to put some pressure on them that way. So there's different,
You
tons
have
of
to fight them.
yeah.
They
gonna call
they
the
tell you no, you just
State
keep fighting
Assembly
them.
to get them to change, the one they're going to in New York as an in-network. But the problem was, their doctor visit was $400, and our insurance paid in-network $80. So it still piles up, you know what I mean? They
But
don't-
it worked.
Yeah, it doesn't cover everything.
Yeah, because you have to fight them.
Yeah,
You
and
just gotta stay with it.
yeah,
I talked to
there's
so
ways-
many people that just said no. You know, well, we're doing the
Yeah.
same thing there that you're doing here, but they have to do it there. That's the only way they do the treatment. No, you know, and it's like, you know, it's
Yeah, finding a different
200 miles
getting
away.
a
What's the
case
difference?
manager.
It's still in state. Well, it's out of network. We're not paying them.
Yeah.
It's a constant battle.
Yeah.
And they train them just to say no.
Yes.
You know.
Yep.
They do, and then they send
But
a letter
there's
to the
different-
vice president, then we're
there's
driving to New York, and all of a sudden they said, oh, Mr. Engel, you're now in network. Oh, that's funny how that
Thank you,
happened.
Councilman.
There's other advocacy groups. We went through Livestrong, the patient advocacy group, when we were going to Sloan Kettering, because when they added beta glucan to 3 of 8, it became a phase 1 study, and we didn't cover it. And they said, we'll cover everything that would be a phase 2 study. And the only thing that it wasn't a phase 2 study was the beta glucan that they gave to us. So they ended up covering, we did travel expenses, but we went through some advocacy groups that took care
So
of
you had
it.
to have
helped us.
radiation. They wanted to start it the next day, and they weren't gonna do it because the insurance wasn't gonna cover it. It was like $32,000. I'm like, I don't have $32,000 to write you a check, you know? All night on the phone, calling, finally they authorized it. You know, it's just, you gotta battle with them, you really do.
And once again, and segueing into the travel expenses, there is a significant amount of travel for these families too, for you guys, going to different entities, going to different institutions, flights, driving, hotels, food, lodging, you know, just, it's extensive. And so that's why these resources are great. We try to use them as much as possible for you guys and reach out to them to be able to help support you and help along the way.
It got quiet all of a sudden. And it's kind of funny. It's like everybody was so talkative for so long. So I think that
Insurance company.
Yeah, the insurance company got brought up.
Yeah.
Everyone said
Does that mean everybody's kind of winding down now? We're kind
I was thinking money and
Everybody's blood
and the estate
Where's
agents,
Yeah, you said insurance.
solicitors, estate agents.
I think you're truly heroes, though. I mean, in what you know, people will say, "Do you see miracles?" And I think sometimes we see miracles, but I think every day the capacity that parents love their children and what they'll do for their children feels miraculous.